How y'all doing? All right. That was impressive for a room not allowed to have coffee in here. I'm surprised you haven't rushed the stage yet. There's a little earlier, there was a blinding light that hit the stage, and it turned out it was just the sun in Portland that I hadn't seen in 3 days. So my name is Benjamin Day. I'm the director of Healthcare Now. I got into this movement first. Thank you. I first got into this movement as a patient, like so many of us. I was admitted to the hospital for 3 days, and when I was discharged, I had health insurance. I didn't have a huge deductible. My doctor sat me down and said, I don't want you to freak out, but your insurance company is not going to cover your stay. The stay was $5,000. I was earning $14,000 a year at the time. So even amounts that, $5,000 is like a standard deductible these days, but if you're earning that little, it might as well be $5 million. And I didn't know that at the time. Maybe I was naive. I had lived in England for a year. I knew what a universal healthcare system looked like. I thought I had done everything. I thought I had insurance. I thought I had protection. I'd learned the valuable lesson that no one in America has health security, unless you're the ultra rich. No one has health security. Everyone, good union, good job, you're one major illness or injury away from losing your job, losing your good insurance, and falling through the cracks of our healthcare system. So I want to talk a little bit about how we structured this conference and what we're going to be covering over all the workshops and plenaries that are coming up after us. So as the speakers have been talking about, our movement has grown by leaps and bounds in the last 2 or 3 years, and our opposition is also growing by leaps and bounds this year. And the impact that that's having is that all the folks, all the legislators and organizations who are kind of in the middle, who have been sitting on the fence, who have been neutral, or maybe they support Medicare for all, but only barely on paper, they're all being pushed into taking a position, for better and for worse. We're gaining allies through that process, but we're also having folks pushed into opposition. This past year, Sophia got Lloyd Doggett to sign on for the first time ever, the Texas rep. He was pushed off the fence in the right direction. We got Joe Kennedy in Massachusetts to sign on for the first time. These are powerful wins, but also, a year ago, we would probably count Kamala Harris and Beto O'Rourke as allies. We thought they were on board. So it's a dangerous time. And it's also interesting because our opposition is mostly going to be fighting us through the media. And we are mostly fighting on the ground. Right? And as of right now, we own the ground game. There is no other organization, not even centrist groups, who are doing grassroots organizing across the country like we are. So what does this moment sort of call for, and what are we going to be focusing on in this conference? I want to talk about 5 themes that almost all the workshops and plenaries are going to be touching on. Number 1 is scaling up, because we know we've been bragging about how many co-sponsors we have on the bill. But if there was a vote on it tomorrow, how many of them would still be there? I don't even want to guess, right? We know we need to have much, much more power to keep the support we have, to solidify it, to hold their feet to the fire, but also all of the low-hanging fruit, the legislators who are kind of already, sort of ideologically in line with us, they've already been plucked. All of the next targets are harder, and we need more power, we need more grassroots capacity to move them. So one major theme, scaling up. NNU is going to do a major talk about that at the end of the afternoon. Another one is building real solidarity across affected communities and across social movements. Why is this important? Well, when they come after us in the media, are they just going to say, we're opposed to Medicare for all, we don't want universal health care? They might, some of them will. But I think probably they're going to start scaremongering about seniors and what's going to happen to Medicare. And maybe that'll stick with enough people and with enough reps that they'll carve off a few votes here and there. Maybe they'll start going after people who have, union health plans or good private insurance right now. And they'll scaremonger about what's going to happen to your private insurance when we move to Medicare for all. Maybe that'll stick with enough people and carve off a few votes here and there. Maybe they're going to say, well, what happens if this covers abortion services? And maybe that'll carve off a few votes here and there. Maybe they'll scaremonger about transgendered health care, reproductive health care. Is this going to cover undocumented immigrants? This is how the attack is going to come. It's going to come after targeting particular communities who we need to be together with, and we're going to have to be able to withstand that attack and defend it, and make this a true everybody in, nobody out bill. If I chant from the mic, it doesn't work. So that's two themes: building real solidarity, scaling up. We already talked a little bit about we have to start moving beyond co-sponsorship and resolutions. For years, we've been focused on how many co-sponsors can we add to this bill. It's not enough. We need to have higher leadership steps that representatives can take, and we need to force them to take those steps to really solidify their commitment level. Medicare for All caucus was the big first step in that direction. Four, and this may sound weird at first, but I think as our movement has grown, we need to do a better job of fewer things. Each of us needs to do a better job of fewer things. And what do I mean by that? If there's a district in Connecticut or Texas where DSA is strong, then DSA should take lead in that district, and we should support them. If there's a district where Healthcare Now is the strongest, then we should take leadership in that district and do a good job of just where we're strong and just doing the things that we're good at, each of us, each of our groups. Doing a better job of fewer things, and whoever is doing the work should be taking the leadership. And then lastly, and Mark alluded to this, we need to start thinking about how can we weaken and divide our opponents. And this is harder, and it's not, if you're an organizer, this is maybe not what you're as used to doing. But we saw that when the Partnership for America's Healthcare Future was launched, with all of the healthcare industry pumping money into opposing Medicare for All, part of that group was the American Medical Association, the doctors group. Physicians for a National Health Program, our allies, waged a campaign to get the AMA to withdraw, and they did withdraw from the Partnership for America's Healthcare Future. So we need to start thinking about, can we make life really hard for the American Hospital Association to be part of the opposition? Ultimately, all of our opponents are using our money to campaign against us, right? These are our premium dollars. We have a certain amount of power over them. We need to start thinking about how we can take that power away from them, as well as building our own power. So those are the 5 themes of the conference. You're going to see the workshops and the plenaries are built around those themes that we felt like kind of captured this moment and what we have to be focusing on. So we hope you guys enjoy the conference. What do we have coming up next?